without further ado, I'm so excited to introduce Dr. David Rhew, who has really become a friend and a colleague. And he did his training actually originally before he became Chief Medical Officer of Samsung America. Did his training here at this hospital at Cedars-Sinai. And we had many mentors in common over the years, and we're kind of in these two different worlds, me as a gastroenterologist, health services researcher, and David as an infectious disease health services researcher. And we kind of knew about each other, and somehow, like, the funny how these things happen, he ended up getting working for Samsung and taking on this new role to try and understand how to evolve this technology from a research and development point of view. And at the same time, I was becoming interested in this technology, and all of a sudden we're like locked together and really working together. And he's been such a great supporter. Without David and his team, this conference wouldn't be here, because I never would have even thought about VR, known what it was, or tried it out. They've been very, very helpful in just introducing us to this technology. And David's whole role is to try and understand how can we use this stuff to manage patients, not just for gaming and entertainment, which is great, but for patient care. So I really credit Dave with so much of why we're here today, and why this guy's over here live streaming to all of you guys is because of that guy right there. So thank you again for that. Come on up and give us your keynote on the cutting edge of therapeutic virtual reality. Thank you. Yeah.
Okay, now can you hear me? All right. When I was growing up, I used to watch this TV show. It's called That's Incredible.
Oh, yeah.
Does anyone remember that show?
I'm still mic'd.
Okay, well.
I do.
Unfortunately, you have just self-identified yourself as not being a millennial. But for those that are not familiar with the show, they had some amazing feats. They had incredible technology. They had people doing things that you never would in a million years believe. And unfortunately, the show is no longer on. But the innovations and the advancements and the things that people are doing today continue. And it would be clearly, if the show were on, this type of work, the virtual reality, the things that we're learning about how it can be applied, would absolutely be a part of that. So a little background, as Brennan had mentioned, I'm a physician, I'm a technologist, I'm a health services researcher, and much of what my focus has been around how technology can be used to improve health outcomes. How can it improve access to care, quality of care? Can we improve the patient experience? Can we make things more efficient and reduce overall healthcare costs? And as part of that journey, it brought me to Samsung, where, as you can imagine, a way that we hadn't been thinking about but really starting to embrace is the role of the consumer, the patient, and understanding that if we make things better for the patient, easier, more convenient, we may be able to create a system that is truly patient-centric or consumer-centric and allow us to be able to address some of those key issues. And that's what we're trying to accomplish. We're understanding how technology can be used to improve the health and well-being for the healthy, the sick, and the aged to create that better world. And so what I wanted to do for the next few moments is just talk a bit about some of the things that we've been learning, specifically as it applies to virtual reality. As Brendan has talked about before, we have seen virtual reality kind of take a very interesting course from gaming and entertainment to now true treatment options in ways that we had never even envisioned before. And what I wanted to do is I want to take you very quickly through that journey of what we've learned over the past decades in this space, and then now some of the cutting edge things that we are seeing today in terms of how this technology is being used in multiple different capacities. But then the next step, where are we going? How do we make this something that can be widely adopted so that patients, consumers, healthcare providers, all of us can take full advantage of that? So that's really the agenda, to kind of go through in a very quick whirlwind, talk a bit about that journey. And as we've thought about virtual reality, it's funny because this is the type of stuff that, as some of you may remember, we had virtual reality, but it was in the form of little viewfinders and things that we had envisioned as being just more toys. And you can imagine before, look at some of the stuff that was originally envisioned. Big machines where you could look into this and create a new world and visualize that. But what we've realized is that we can now take that and make this something that goes beyond the entertainment, goes beyond things that we had thought were important and are still very important. But what we had envisioned was that this could be now a mechanism for education, for training, maybe giving virtual tours of facilities and places that we had never been to. And then what we had heard recently is about distracting people. But that is just the starting point for what we can do. And what we had just heard was that it can now be used as a non-narcotic alternative to address pain, reducing pain in a randomized controlled trial by 52%, reducing stress and anxiety by 60%. It's something that we're now recognizing could be a very valuable tool. And the question that I oftentimes get is, well, why is it working this way? What is the reason? And I wish I had the answer, but I can tell you what we know today. And what we know today is that if you were to do a functional MRI of individuals that have pain, their brain will light up like a Christmas tree. It's all yellow, and you'll see on this image on the top that clearly there's activity. There's high-level neurons and chemicals firing, and it shows that we're just focused on that pain. But when you have virtual reality and these treatments, and even after you've taken the headset off, which is the remarkable part, so it's not just being distracted for that moment, but it's this persistence of the pain relief, we can still see a quieting down. And that's seen visually on the functional MRIs. What some people believe is going on is that you're so overloaded with stimuli and your sensors are so overloaded that much in the same way that morphine works by blocking these receptors, we now have an ability for us to be able to use this as a way to overstimulate our receptors and essentially block them. And we're seeing it from a functional standpoint in terms of people having pain relief on par with narcotics. That has been something that I think the work here at Cedars-Sinai is really going to pave the path for us to think differently about how we use virtual reality as a pain option or pain treatment option. But the other things that we hadn't been thinking about were, could you use virtual reality in ways that could address other medical conditions? And one of those is around poor vision. So we've been very fortunate to learn a lot about what's been going on in this space by talking to researchers that have spent a lot of time evaluating in the low vision area what is the actual cause of it, and is there a way that we might be able to use technology to change one's ability to view the world. And in doing so, we ran across some research that has ultimately led to a product called Iris Vision that is addressing issues that affect many of us, or I should say many people, those with macular degeneration, those with Retinosyn Pigmentosa, glaucoma, and a variety of other conditions that cause blindness. So if you take macular degeneration as an example, the way that the disease works is that there's damage to an area called the fovea, which causes a central blindness. So imagine living a world where you've got a black spot in your visual field, and it continues to get bigger and bigger, and it's really hard to see around that. So people oftentimes are looking around trying to see. But it turns out that we actually, every one of us, have an ability to leverage intact processes within the visual field, specifically an area called the PRL, the preferred retinal locus, which is a small area, but if you imagine a window being a little farther out, you can actually see through that. It's got some visual acuity. Too bad it's so small. Well, we have now an ability through the camera, through the ability for us to be able to leverage its magnification, ability to improve the contrast, adjust for photophobia, to change that such that individuals that were previously looking through this really small hole can now have that magnified to the point where literally their vision is restored. So how do we know that? Well, in studies performed by leading ophthalmology centers across the country, this is one that was performed by Johns Hopkins, where they looked at this technology and they understood that individuals would have a variety of different goals. They would want to know whether they could improve their reading, their mobility, and you can see the MCID, which means basically did it improve at a significant amount of difference, that a large percentage of these individuals actually had improvement with this technology. It's a headset, it's the VR headset, but it's essentially serving as a corrective lens. And when they looked at the baseline vision for these individuals, the majority of them were around 2400, which is legally blind. But then with this, they were restored to around 2030. Which is remarkable. It's literally going from blindness to vision. And we have seen this anecdotally. In fact, there was recently a Paralympian who I was tweeting with. She had tried this on blind since the age of 17, tried it on just a few months ago, had a dramatic improvement in her vision with this. We presented this at the Federal Trade Commission. They brought in an individual who had recently developed blindness over the past, I guess, several years, over the past 5 years. He was fairly young, in his mid-40s. And he literally started weeping because he could not believe that he could see for the first time in the past 5 years. This is the impact that we're having, that individuals now have an ability to leverage this technology to be able to do things that they had never envisioned before. And that's just with macular degeneration. Retinosyn pigmentosa is sort of the flip side of that. That's one where you, instead of having central blindness, you have peripheral blindness. And so because of that, what you have is a small area of vision. But imagine if you were to take a step up to that and look through that, it expands your visual field. And that is a very important way for us to be able to address the issues that affect other medical visual issues, retinosyn pigmentosa. And we're seeing that the opportunities to use technology to enhance one's vision are tremendous. In fact, this technology, just to give you an idea, is being used by over 80 ophthalmology centers across the country, including UCLA, Johns Hopkins, Stanford. The challenge is that we have, within the medical community, found only a certain number of individuals that use this. So what we need to do is we need to start thinking about how do we get this to the point where everyone knows about it and everyone's aware of it, including physicians. I mean, it's really remarkable how it takes about 10 to 15 years for cutting-edge medical evidence to be brought to real-life practice. But nowadays, we have the ability for us to communicate, and we have the ability for us, for patients and others, to use Medium to be able to share this and hopefully accelerate the pace of adoption so that we might be able to get this to the point where people are using it regularly and widespread. Now, this is a really interesting story because this is one that I had not even thought of. But when I heard about it and I did a deeper evaluation of what is really going on here, it made perfect sense. And this is around using virtual reality to treat spinal cord injury patients. And many of these individuals were paraplegics who had lost all function. So in this study, it was published in Nature. It was done by a lead researcher from Duke. They had 8 individuals that were completely paralyzed. Loss of bowel and bladder. This is a spinal cord injury, but not a complete severing. So injured to the spine, major neural networks damaged, but they had not actually had complete paralysis. Had complete severing of the spinal cord. But they were paraplegics. They had loss of upper and lower extremity function and loss of bowel and bladder. And some for as long as 3 years, and some going all the way up to 13 years. So it is not like this just happened. This is stuff that they've been living with for quite some time. And what they wanted to know was, could we use virtual reality in conjunction with an exoskeleton to help facilitate the movement and an aggressive physical therapy to essentially retrain and rebuild some of the neural networks, the neural pathways. Because if you think about how one moves, if I wanted to move my hand, I send a signal from my brain down to my spinal cord, to my hand, and then I move it. If I touch something, it sends a signal up from there, up the spinal cord to the brain. There's a bidirectional path that just so happens to go through the spinal cord. Now, what happens in spinal cord injury is you've damaged one of the major neural networks or the neural paths, but there are still other dormant paths that have never been explored. But the problem is we don't know how to use them. So what you're doing is you're really tricking the brain and showing them that you can move things. You have an ability to send signals upwards and downwards, and for some miraculous reason, through neuroplasticity that we had envisioned, they're starting to make some connections. And what we had seen in this study, a 12-month evaluation, that all 8 patients had improvements. And in the study, 4 of them were upgraded to incomplete paraplegia classification. And then in follow-up, all of them were upgraded. In fact, there's an incredible YouTube video of one of the individuals who kicks a ball at the World Cup. First time ever, I mean, just amazing stuff. And that's what we're starting to recognize, that the brain and the nerves are very dynamic. It allows us to sort of think about the power of using the virtual reality to trick the brain to be able to do things that we hadn't thought were possible. This is another great example. This is an example on traumatic brain injury and concussions. And what we had not thought of before was the interrelationship between eye and the brain. And in fact, if you were to put a VR headset with eye tracking software, and this is already being done by researchers and many individuals at Stanford and across the country, you'll notice that the eye tracking software, that you can determine that a normal person, as they scan through a dot that moves around, has a very streamlined, nice, and you'll see on the left-hand side, a nice path. But for individuals that have had a concussion or traumatic brain injury, it's very abnormal. It's jagged. And in fact, now with the technology, we can quantify and subdivide these patients into 6 categories. And based on the categorization, we may potentially be able to use eye tracking software in conjunction with the VR, such that it allows us to be able to not only improve the eyesight tracking, but potentially around improving concussion management. And that's the ongoing research that we're now starting to see, that potentially we may be able to use this to help individuals that have had traumatic brain injury and concussion to earlier recovery. And so this is the type of stuff that we're now starting to see widely used. It is, by the way, currently being used by all of Stanford Athletics. The Golden State Warriors use this. They're starting to look at this in the Department of Defense. A significant amount of opportunity in this space. Another area which we are extremely excited about, because we think this is a tremendous opportunity for us to think beyond what we currently do, is how VR could be used for seniors. These are individuals who oftentimes suffer from conditions that afflict many of us or many of our families, Alzheimer's, dementia, agitation, sundowning, you name it. But we have seen anecdotally that this can decrease those incidences, and it also potentially allow us to do things that we hadn't thought of, such as enabling people to start talking about things. In fact, one of the major treatments for reminiscence therapy, which is the treatment for dementia, is to get the individual to talk about their experiences. But many times there's a mutism. They choose not to. But this is elicited. The VR has elicited this, and we have seen this, and we're now starting to recognize that this could be a very valuable tool for seniors. But what I've shared with you is kind of the tool. The tool is the virtual reality. It's been shown in many different ways to be beneficial. But it is just one tool. And if we want to build a house, we need more than just one tool. We need to put together this in the structure of a program. And that's why we're so excited at Samsung to be partnered with Cedars-Sinai and Travelers and Applied VR and Bayer and a variety of other groups that are now starting to think about how can this be put together as a program to holistically treat patients, combining other modalities together, looking to see how can we implement this as a program or a pathway, figuring out ways that whether clinical decision support could be used. That is how we make this operational. So we've got great tools, but it needs to be put into the context of a program. And we're doing that not only in the context of pain, but we're also starting to think about how can we address issues around social isolation, sense of purpose, which is an incredibly important issue today, by using VR as an intergenerational tool that will help us connect young individuals with older folks. It's an incredibly powerful tool to allow us to be able to start that process. And using things such as VR with music therapy, could that be helpful in terms of enabling these individuals to better health? So what we've talked about in this very brief discussion is a quick journey of where we've gone. And it's funny because if you think about the history of all the things we've learned about virtual reality, it actually has been well studied for many years. In fact, if you go to the meta-analyses, people have studied this. But only in the past 5 years have we seen the dramatic explosion in terms of all these use cases that I've talked about. Why is that? Well, 3 things happened. The first was the technology got better. And so now we had an ability to do things that required really expensive computers, big, clunky ones, to the size of a cell phone. Second thing is that it became mobile. And it was really something that now you could be done outside of a clinical research setting. It could be done in any setting, an ambulatory clinic, across hospitals and other places around the world. And the third is became much more affordable. And it is something now that because of those three things, we have an ability to explore use cases that we had never envisioned. And that's what's so exciting about virtual reality, because we now have an ability to be able to think about all the possibilities of how this can improve the lives of those with disability due to injury, illness, and age. Thank you very much.